Good afternoon. I'm Dr. Andrew Loblaw, and I'm the head of the GU Radiation Oncology Group at the Odette Cancer Center in Toronto. And I want to thank the Ride for Dad for their generous support of our research program for a research grant that we've submitted called EARTH. Basically, brachytherapy is now the standard of care in terms of the management for patients with intermediate and high-risk prostate cancer. Our brachytherapy program at the Odette goes back 20 years now, and was first started with what is called low dose rate brachytherapy. This is where seeds are permanently implanted into the man's prostate and stay there forever. The activity of the seed basically dissipates over a year's period, and it provides very high cure rates. The chance of the cancer going away for the typical patient, i.e. the intermediate risk patient, is between 90 and 95%. Paragraph. Sounds like I'm dictating. We developed what's called high-dose rate brachytherapy. Our first implant was in September 2001, and that basically is a temporary seed implant where a highly radioactive seed, 10,000 times more active than the LDR brachytherapy seeds, is implanted into the prostate, again while the man is asleep, through tiny catheters, about the size of the inside of the Bic pen if you were to pull it apart and look at the inkwell. The original program coupled HDR brachytherapy with 5 weeks of external radiation or 25 external beam treatments. And while that was highly successful, it was quite a burden for men traveling back and forth for these treatments. Gradually, we actually reduced the number of fractions in partnership with Ride for Dad and other cancer charities, and made it in combination with 3 weeks of external radiation treatment. And then we went on to drop the external beam component altogether. Dr. Morton and myself did a study where we randomized patients between 1 and 2 fractions of radiotherapy, and that showed that we were able to do this, and that 1 fraction of radiation was very successful in terms of minimizing the side effects associated with treatment, and seemed to have good control rates compared to the 2 fraction approach. Over time, we started to see that there was a slightly higher risk of the cancer coming back with the single treatment, and we then moved on to doing an MR guided boost, so the whole prostate gets a certain dose, and then the area where we can see the cancer on the MRI gets another extra punch of dose, and that's actually been much more successful in terms of getting rid of the cancer. Seem to have the same control rates as the 2 fraction approach, but again without the side effects. The difficulty is that while the side effects are very good compared to other treatments, particularly surgical treatments, about 1 in 4 men is still left with significant sexual changes and bladder habit changes after treatment, and we're trying to improve on that, and that's where EARTH comes in. EARTH basically keeps the dose to the MR nodule at the same level, but cools off the dose to the whole prostate, including the nerves that control the erections in the back or posterior part of the prostate. So our hope is that with a single treatment, a man can get an MR-guided brachytherapy approach, but have less sexual impact. So I'm very excited to be able to launch this program with our team, brachytherapy team here at Odette, and I want to thank Ride for Dad for supporting us once again. Thanks.